How do we fix healthcare? The American way, not the French way, not the English way, not the Cuban way, not the Canadian way. How do we fix it the American way and make it work better for everybody? How do we make it work for more people, work better, and work cheaper? Well, there's only one way to do that. There's only one way to make something cheaper and better. It's called a large consumer market. It's the only way you can do it. You got to have private ownership. All of us have to take a little bit more control, each one of us, to make a contribution by taking a little bit more control of our health care. So here's what I would do. I would try to urge as many Americans as possible to go buy their own health insurance. And that fits with the trend in America. In the old days, which is when I started working, and I imagine what some of you did, right? Somebody would be at the same job for the same company, maybe for a career, maybe 2 companies, maybe 2 jobs, maybe 3. You know what it is now? I think I'm right about this. I think now the average is more like 8 to 10. Somebody's going to have 8 or 10 different jobs during a career. So what I'm recommending is that we give a big incentive for Americans right at the very beginning to go get their own health insurance. How do you do it? You create a $15,000 tax exemption for a family. $7,500 for a single individual. That could be converted then into a family. One person gets married and starts to have children. You get that right off your taxes, right off the top. If you go buy a health policy, if you can go find one for $12,000, let's say, that meets your needs, then you get $3,000 in tax-free money for yourself. You keep that. Put it in a health savings account. That can be converted into a pension account. This, over a lifetime, people start this at 21, 22, 23, 24, 25, 30. This can be an enormous amount of money. The idea is that people will have an incentive to buy their own health insurance. They'll get a big tax deduction for it. They'll get room for a health savings account. And as that health savings account grows, you can start thinking of a higher and higher deductible, which means you can take the premium down even further. Now, when you're doing that for yourself, you're helping yourself. But let me explain this to you about how market economics works. When you're doing that, you're helping everybody else too. Because you're driving the price down for everybody else. If one person does it, that helps. If 2 do it, helps even more. 100 do it, helps a lot. 1,000 do it, 1,000,000 do it, 2 million, 3, 4, 5 million. Now remember, the people that don't have health insurance are not the poorest of the poor by and large. The poorest of the poor have Medicaid. People who don't have health insurance are the people who are unlucky enough to be in that sort of middle or that gap. So they have some resources. Just that health insurance is too darn expensive for those resources to mean anything. So the job that we have to do for all Americans is to bring down the cost of health insurance and find an honest, real market, like they did for televisions and iPods and telephones, and deal with it the American way. In short, to sum up, the whole purpose of this is we got to solve our healthcare problems with American principles, not with principles of socialism. And I know my good friends, the Democrats, will say this is unfair, and they're going to squeal and all this stuff. It's unfair to say socialized medicine. But you know, you got to. I'm a realist. I face reality. That's what it is. You take more people, have the government cover it. It is called socialized medicine. That's what it is. Go look at the other countries who do it, who have the single-payer system. Look at their experience with it, and do you know what they're doing? They're changing to our kind of system because they are in ruin with the system they have. I don't care what Michael Moore says in his movie. I have had lots of people ask me for help in finding hospitals and doctors, particularly for cancer. I've had lots of people ask me that. I've had some people from Europe ask me that to get help to come into an American hospital. I have never had anybody ask me for help to get into a Cuban hospital, or a Canadian hospital, or an English hospital. They all want to come to America. So let's take what's right about our system and let's improve it.